Hello, and welcome to the presentation on Introduction to Solids. My name is Lindsay, and I'm one of the dietitians at New Vision Family Health Team, and thank you so much for joining me today. So today we're going to cover recommendations from WHO and Health Canada about breastfeeding and introduction of complementary foods. We're going to learn about what and how to feed your baby and how to introduce those solid foods. We're going to talk a little bit about food safety. So WHO stands for the World Health Organization, and the following is the WHO and the Health Canada recommendations. So they do recommend that infants are exclusively breastfed for 6 months with timely initiation of adequate, safe, and properly fed complementary foods. They continue to breastfeed for up to 2 years of age or beyond, whatever your comfort level is. We want to provide 400 international units of vitamin D supplement daily if fully or partially breastfed. And if baby is not breastfed, then they will need formula. When baby is about 9 to 12 months, eating a variety of foods, including iron-rich foods every day, we can start to replace the formula with pasteurized, homogenized cow's milk, up to 2 cups a day, no more than 3 cups a day. We'll cover this a little bit more later on. So ultimately, fed is best. So there's lots of messages out there about pros and cons of breastfed versus formula fed, and I'm sure we've all heard the saying breast is best. At the end of the day, we like to encourage that fed is best, and this will look different for different families, and what you need to know will work best for you and your baby, whatever that may look like. I want you to take some time to think about your eating experience. Were you ever made to eat foods you disliked or made to eat more or less than you wanted? Did your family have any food rules? For example, we can't leave the table until we completely finish our plates. We can't eat in front of the TV. How do you think this may have affected your current eating attitudes and behaviors? Healthy eating habits are a learned behavior and can start from a very young age, which is why it's important to start developing these habits right at the beginning. And again, we'll talk a little bit more about this as we continue through. So what are the signs that your baby may be ready to start solid foods? So are they around 6 months of age? Are they able to hold their head up on their own? Are they able to sit in a high chair with limited assistance? Are they starting to show an interest in food? So this may be intently watching you as you're eating, kind of reaching for food around them. Are they able to open and close their mouth around the spoon? Can they turn their head away if they're not interested or not hungry? So showing you signs that they're finished eating or they've had enough. Can they swallow, and do they have good tongue control so that most of the food we're providing is going to stay in their mouth? Babies go through growth spurts around 3 weeks, 6 weeks, and 3 months. This is not necessarily a sign that the infant cereals are needed or solid foods are ready. We want to be looking at those signs above to make sure that they are ready to be starting solids. I always like to show this picture too, just as a reminder that starting solids can be messy. It should be a fun process, but we really want to let them explore their own sensory. So touching the food, playing with the food, bringing it to their mouth on their own. Again, it may look something like this and food could be everywhere, but enjoy the process. So why do we want to wait until about that 6 months of age? So physiologically, infants' digestive system and kidneys are immature up until about that 6 months of age. We want to make sure that both those systems are strong and in place for when we start solids. If they may not be able to sit up or hold their head up before 6 months of age, and we want to make sure there's a strong extrusion or gag reflex, making early feeding more difficult. So that tongue thrust reflex protects against choking. It's a natural response when something touches the lips. Nutritionally, it can start to reduce the intake of breast milk and formula, and we want to make sure that, again, that's going to be the primary source of nutrition. And nutritionally, it's just not necessary before 6 months of age. So why do we need to start solid foods around that 6 month mark? A big one is that we need extra iron. So at about 6 months of age, baby's iron stores start to go down. We want to make sure that we're replacing that with those iron-rich foods. We also want to begin to introduce new flavors and new textures for them. So introducing solid foods. So we do not let solid foods replace breast milk or formula, which has more nutrients and calories than the solid foods. So again, any solids that we're adding should be complementary. We want to introduce new foods one at a time, especially for those common allergen foods, which we'll talk about a little later on. We want to be having babies sit upright, for example, in a high chair. We want to make sure that whoever's feeding is sitting in front of and facing the baby. We want to offer when baby is alert, so waiting for the baby to pay attention and to open their mouth. If they're showing any signs of being tired or disinterested, it may be a sign that they're not ready for solids at that time. We want to make sure that we're looking at them, talking to them in a kind and encouraging manner, and making that mealtime experience a pleasant one. And at the beginning, we want to make sure that we're breastfeeding or offering formula first, and then offering solid foods after. Again, just to make sure that we're not replacing that breast milk or formula. Solid food should be complementary. So at first we want to offer small amounts, and we're going to follow baby's lead. So they may only have 1 to 2 teaspoons, and that's perfectly fine. They may eat a little bit more, but kind of letting them judge. And again, we'll talk about that a little bit later on. We don't want to be forcing new foods. So let baby decide how much they want to eat, and stopping when baby is losing interest. So not force feeding or kind of making them finish what you've provided for them. Again, letting them take the lead. So feed the baby the way they want to eat. Some babies will eat pretty quickly. Some babies will eat a lot slower. They may eat a little bit, or they may eat a lot. Let baby self-feed when ready. And again, a mess is okay. It's normal. Babies need to explore food to get more comfortable with it. So this may be playing with their food, touching it, putting it in their mouth and spitting it out. It's all part of developing a normal and healthy relationship with food. And we may see a change in bowel movements when we're introducing solids. So it could be something like a change in color, odor, consistency, and frequency. This is normal. If we start to notice any blood in stools, or babies having chronic diarrhea or constipation, that may be time to see your healthcare provider. So how much? So a hungry baby is going to be reaching for food, paying close attention to the food. They may act upset when food is taken away. A full baby is going to start to shut their mouth, so they won't accept that new food if you offer. They're going to push that food away. They may even turn their head when food is near their mouths as an indication that they don't want anymore. We want to start with offering a small amount. So again, maybe only 1 to 2 teaspoons, and that's perfectly fine. When you start giving your baby solids, their daily intake of breast milk or formula is likely going to gradually decrease by about 720 mils, or about 3 cups. Once our baby is fully established on solids, they'll need about 500 to 600 mils of formula every day, alongside with a varied diet. If they don't want to consume this amount of milk, you can always give them milky foods such as yogurt and cottage cheese. Keep in mind that these are only rough guidelines, and your baby will let you know if he's getting too much or too little. If you're not sure, you can always talk to your baby's doctor. So what foods do we want to start with? So at 6 months, we mentioned that we want to be starting with those iron-rich foods, because baby stores are starting to run out. Iron-rich foods include iron-fortified baby cereals, starting with a single grain, for example, oat or barley. Homemade rice cereal does not provide adequate iron. So you want to speak with your dietitian regarding iron supplementation if you're going to prefer to do a homemade cereal. Meat such as well-cooked chicken, beef, pork, or fish are also good sources of iron, as well as meat alternatives such as beans, lentils, and cooked eggs. Once we have babe established on some iron-rich foods, then we want to be adding in some good sources of vitamin C. These are also important because vitamin C can help with the absorption of iron. So some of those vitamin C rich foods may include many types of vegetables and fruits, such as apples, pears, berries, mango, sweet potato, broccoli, tomatoes. These can be introduced once our baby is used to having some of those other iron-rich foods. So again, we want to be starting with those iron-rich foods. So it may look like eggs, beans, chicken, meat, infant fortified cereal, or fish. Then we're going to start to add in those vitamin C foods, such as our fruits and veggies. And then we want to start to add in foods with different textures and tastes. So we may again start to explore adding in some cheese, well-cooked pasta, some crackers, cottage cheese, dry cereal, or maybe even some whole grain bread. So just to kind of go over the iron content of some of those foods. So babies between 7 to 12 months of age need about 11 milligrams of iron per day. Toddlers 1 to 3 years need about 7 milligrams of iron per day. So here are some common iron-rich foods and then roughly how much iron is going to be in there. So 4 ounces of beef, going to have about 3.5 milligrams of iron. 4 ounces of pork is about 1 milligram. 4 ounces of lentils is about 3. If we're looking at that iron fortified cereal, so 5 tablespoons is going to be that 11 milligrams that they're needing. 1 egg is a little bit lower, 0.7 to 2, and then 3 ounces of salmon is the same. 4 ounces as a rough guide equals about half of a cup or about 8.5 tablespoons. So again, at 6 months of age, we're going to introduce those iron-rich foods. So maybe that or iron-fortified cereal or meat and meat alternatives. 6 months, we're going to start introducing those vegetables and fruits, cream products, meat and alternatives, dairy products and alternatives such as yogurt or cheese. And then at 9 to 12 months, we can start to introduce that fluid milk or that whole milk. And we do want to make sure it's the homogenized or the 3.25%. If whole milk is introduced before 12 months, we do want to make sure baby is consuming iron-rich foods daily, at least twice a day. So we want to be avoiding any added sugar or salt, etc., during the first year. Using spices and herbs to flavor foods and expose baby to new variety of flavors is perfectly fine. Choosing foods that are part of all of the food groups is important. So making sure we're offering those fruits and veggies, grain products, milk and alternatives, meat and alternatives, that gives a good variety and balance of nutrients. We don't want to be offering foods like chips, fries, fast food, sweets, processed meats, and desserts within that first year. So introducing some allergenic foods. So our most common allergenic foods are going to be eggs, milk, wheat, tree nuts, sesame seed, sulfites, soy, seafood, mustard, and peanuts. There's no evidence that delaying the introduction of allergen foods past 6 months will prevent food allergies. In fact, we recommend introducing them early, so before 9 months of age is recommended, potentially earlier if at high risk, and that's something you can review with your healthcare provider. When we're introducing common allergen foods, we want to watch for signs and symptoms of an allergic reaction, which may include hives or skin changes like eczema, redness, vomiting, diarrhea, or swollen eyes. So here's kind of a sample menu of our first feeds. So early morning, we might be offering that breast milk or formula. And then in the morning, maybe for breakfast, we might be offering that breast milk or formula again first, and then adding in some of that iron fortified infant cereal. You could even potentially make with breast milk or formula, or even some pureed or soft pieces of fruit. And then for a snack, we're going to again continue to offer the breast milk and formula, maybe even again at noon, and then for our afternoon snack. And then we might try solid foods again in the evening. So again, offering breast milk and formula first, and then that evening meal might look like some pieces of moist cooked meat or meat alternatives, or iron fortified infant cereal again mixed with breast milk or water with pureed or soft pieces of vegetables. And then probably that evening snack is going to be the breast milk or formula again. So at 6 to 8 months, again, we're still offering that breast milk or formula first. We might now be offering a bit more of a structured 3 meals, 3 snacks a day. So more like a breakfast, lunch, and dinner, and then a couple snacks in between. So again, breakfast could look like that iron fortified infant cereal with breast milk or formula and some soft fruit. A snack may be introducing some other grains, so a small piece of toast, bread, crackers, roti, or pita. And then noon, again, we might be introducing maybe some veggies or some more iron-rich foods like the chopped meat or meat alternatives, maybe some soft ripe fruit. The afternoon snack could be a couple pieces of cheese, maybe a homemade muffin. And then in the evening, again, we're going to be looking for that iron-rich food. So the meat alternative, maybe some veggies and then a grain to go in there. And then evening snack may look like some soft fruit or plain yogurt. Again, in terms of the amount, we're really going to let baby dictate how much they want to eat. So we can offer these foods. They may have a little bit, they may have a lot. It may also vary from day to day, and that's completely normal. They may be very interested in solid foods and not so much the second day. Again, just kind of going on with what their lead is. And then at the 9 to 12 months, so this is when we're going to start to be offering food first and breast milk or formula after. And then by 12 months of age, young children should be offered a variety of family foods with modified textures such as ground, mashed, or chopped foods with a tender consistency. So again, we still may be offering that breast milk or formula frequently through the day, but now we're going to be offering it after solid foods. And we, again, will probably be into more of that 3 meal and 3 snack a day structure. So progression of textures. So at 6 to 7 months, you might notice that they're able to hold their head up. They're sitting with little help. They can open their mouth when food is offered. They're reaching out and maybe curious about food, is able to take food from a spoon, and again can show signs that they're maybe finished eating by turning their head or refusing the food, and they can begin that chewing motion. Appropriate food textures, so a variety of textures including smooth, soft textures or soft finger foods. So this might include some soft cooked vegetables or soft ripe fruit, finely minced, ground, or mashed cooked meat, or deboned fish or poultry, maybe some bread crust or some toast. At 6 months, they're likely going to be starting to finger feed. They can close their mouth on a cup rim and sips from cup with some help, showing an interest in feeding themselves. So again, wanting to take over some of that feeding skill. We don't want to start delaying introduction of the lumpy textures past 9 months. So if we're starting with purees, when we get, between that 6+ months, we want to make sure that we're introducing newer textures. So that might look like grated, lumpy, diced, minced, or cut up. We can start with mashed soft textures and then transition to more minced, ground, or lumpy as they progress. And by 12 months of age, young children should be offered a variety of family foods with modified textures, as we discussed. So baby-led weaning. So this is one of 2 approaches that we commonly see. It's an alternative method for introducing complementary foods to infants. So for a while, it was usually just strict purees to start. This is an alternative method where we're actually giving them more handheld foods and letting them feed themselves versus being spoon-fed by an adult. There isn't enough evidence to recommend one approach or the other. I typically find that moms do a combination of both. Benefits, so infants eat the same food as the family, so no baby food making. It may help your baby accept different foods and be less picky eater. Some risks, it could risk inadequate nutrient intake. Again, if they're really driving their own eating, they may not eat as much, specifically important around that iron, and there is an increased risk for choking or gagging. We definitely want to make sure that we're monitoring all meals when practicing baby-led weaning. And we want to monitor babe's growth to ensure normal growth and development. When it comes to this style of feeding, to ensure it's the right texture, you can always test the food by squishing the food between your tongue and the roof of your mouth. If it squishes down nicely and it's very soft, that's an appropriate texture to offer the babe. So examples of some finger foods that we might want to give to our baby. So again, toddlers enjoy feeding themselves. So offering healthy, nutrient-dense foods they can eat with their own fingers can be fun. So this may look like some soft, ripe, peeled fruit, such as pears, cantaloupe, peaches, bananas. If we're offering things like strawberries or grapes, we want to make sure that they're cut into bite-sized pieces. We may be offering some cooked vegetable pieces like carrots, broccoli, sweet potato, dry toast strips, bread crusts, or unsalted crackers, maybe some pieces of a homemade muffin, unsweetened cereals, cheese cut into cubes or slices, cooked tender meat, so either cut up or ground, cooked cut up pasta, cooked beans and other legumes, or maybe some pieces of some avocado. So offering beverages. So again, at the beginning, if baby is not breastfed, they will need formula. And they should be exclusively fed this until 6 months of age. Homogenized milk, or that 3.25%, can be introduced between 9 and 12 months of age. Again, we want to ensure they're consuming iron-rich foods first. Lower fat milk, such as skim 1 or 2%, or our milk alternatives like soy, almond, or coconut, are not recommended until at least 2 years of age because of their lower fat content. Rice milk and almond milk are also not recommended for infants. Juice should be limited in the first year. After the first year, no more than half a cup per day. It's not necessary. Actual fruit is better, but if you are going to offer, limiting to that half a cup. And small sips of water in an open cup can help support development of mature feeding skills. So let's talk a little bit about that open cup. How do we offer this? So we're going to find a small cup. Handles, weighted cups, and cutouts for little noses are all optional. You know your baby best. There's no one size fits all. The appropriate size for little hands and mouths is what matters most. And then change it up from time to time so they don't get stuck on a particular kind of cup. We want to fill the cup right up to the rim. Hold the cup out towards the baby. Encourage them to be involved in holding the cup and guiding them using a hand over hand motion. Place the edge of the cup onto the bottom of their lip. The amount you tilt the cup should be minimal at first, partly because the fluid is already almost at their lips, but also you want really only to wet their lips at first. You may want to even coat the edge of a cup in a favorite puree to increase lip closure and motivation. Think like a sugar-rimmed margarita glass, but don't actually put sugar on the edge of their cup. Consider slightly thickening the fluid, so gradually reducing this consistency over time. As anxiety over messes subsides, reduce your involvement in holding and tipping the cup. It will require some time and patience and some spilling and messes, but no one goes off to college drinking from a sippy cup. Consistent short practice sessions with a cup each day will guide the baby well before there is ever any expectation for them to take full volumes by the open cup. So again, we're really just focusing on developing those skills. If you need to use a sippy cup for convenience sake, there are times and places where that may be necessary. Consider spoutless cups or straw cups, but no need for parents to feel guilty about having a sippy cup in their cup drawer for such occasions. Sometimes it is necessary. So breast milk storage. So we want to store in small portions to minimize waste. We're not going to fill that container right to the rim. We want to leave room as breast milk will expand as it freezes. We want to indicate the date that the milk was expressed. Expect milk to separate during storage. So before feeding, we can just give it a swirl to mix the milk and the cream together. Milk may be safely refrigerated for up to 5 days. We want to store milk in the back of the fridge where that temperature is going to be the coldest. Milk may be stored in a freezer that maintains an ideal temperature for 6 to 12 months. And when we're thawing that milk out, we want to place it in the refrigerator overnight or in a container under warm running water or in a bowl of warm water. Milk may be stored in an insulated cooler with ice packs for up to 24 hours. It can be safely refrigerated for up to 5 days. Again, we talked about that. Milk may be stored in a freezer compartment located inside a refrigerator for 2 weeks. It can be stored in a refrigerator freezer with a separate door for 3 to 6 months. And milk may be stored in a deep freezer that maintains the ideal temperature for 6 to 12 months. So we're going to talk a little bit about division of responsibility, and this helps to create a happy and healthy eater. So we break it down into the parent's role and the child's role. So as a young infant, our parent role is going to be the milk source that's offered, so either breast milk or formula. And the young infant's going to decide when they eat, where, and how much. As they get older, by about 1 year, parents then decide what food is being offered, when that food is offered, and where we're offering that food. And the child is going to decide how much they eat or if they eat at all. So how you feed your children is as important as what we feed them. So children are very good at regulating their food intakes. We want to make sure we're trusting their judgment. Parents can either play a positive role or a negative role in their child's food acceptance and food regulation. Positive conversation at meal times that do not revolve around whether or not they ate, limiting distractions at meal times. So turning off those screens, tablets going away, TVs being turned off, and offering new foods for them. Many children can react negatively to new foods, but will usually accept them with time and positive experiences. And this is much easier to start now than to try and correct in the future. So non-responsive feeding relationships may override an infant's internal hunger and satiety cues and interfere with their emerging independence. So for example, pressuring infants to eat by using excessive verbal encouragement. So wanting to avoid phrases such as clean your plate. On the other hand, parents and caregivers who restrict higher fat, energy-dense foods due to concern about overeating may adversely affect self-regulation and actually increase the child's intake of foods when they are offered. So children will learn to like a variety of foods. So research tells us that children may taste and remove foods from their mouth 10 to 15 times before they actually swallow it or can say they like it or not. Most caregivers or parents will give up after the child has tried a food and refused it 3 times. We want to make sure we're continuing to offer a variety of foods from all 4 food groups, even if previously refused, to continue to expose. So talk about some food safety. So to prevent foodborne illness, we don't want to be offering honey in the first year of life due to risk of botulism. We don't want to be giving raw or undercooked eggs. We want to really follow those best before dates. So I know as adults, it's oftentimes thinks, oh, it's just a week overdue, I'm sure it's fine. With our little ones, we want to be a little bit more diligent. We want to wash raw fruits and veggies well. Preparing infant formula, so we want to use a safe water source, including fluorinated municipal tap water or commercial bottles like spring or tap water. All water sources should be made safe by boiling for at least 2 minutes. So warming foods and liquids, we always want to test the temperature before serving to our little ones. We want to be careful if we're using the microwave. Microwaves can heat unevenly and create hot spots that can burn the babe. So we want to make sure that we're stirring warm foods or shaking liquids well before serving and testing that temperature. We want to sterilize water, bottles, nipples, and caps until the baby is 4 months old. And we want to make sure we're throwing out any leftovers at the end of the feeding. So here are some cookbooks or other fun book suggestions if you're interested. So again, some of those cookbooks, and this might be with more information about baby-led weaning if you're interested. So the Parent's Guide to Baby-Led Weaning with 125 recipes, or Baby-Led Weaning. And then some other fun reading books might be Edible Numbers or Eating the Alphabet, Fruits and Veggies from A to Z. Here are some other ones, the ones we just mentioned. Baby-Led Weaning Cookbook and Better Baby Food. And here are some recipes for different meat and legume purees. So if you are wanting to make your own homemade baby food or purees, so we're going to take those ingredients. We're going to remove all the fat and skin from meat before we cook it. We're going to take about 1 cup of that cooked and chopped chicken, beef, turkey, fish, with making sure there's no bones, legumes, or lentils, whatever our food of choice is. And then we're going to add about 2 to 4 tablespoons of liquid. So this may be breast milk, water, or cooking liquid from the vegetables or fruit. So we're going to place the cooked chopped meat or legumes and lentils into a blender. We're going to add 2 tablespoons of that liquid to start to puree, and then slowly add another 1 to 2 tablespoons until we've reached that smooth consistency. We're going to serve baby their portion and freeze the remaining puree. And as baby grows older, we can eventually increase the texture. So blending it a little bit less to leave it a little bit more lumpy. Again, kind of similar for a vegetable and fruit puree. So we can take fresh or frozen fruit or veggies, making sure that they're washed well, peeled, and cut up. So using the stove, so we can place the vegetable or fruit pieces into a steamer in a small amount of boiling water and simmer until they're well cooked and tender. Or we can use the microwave, so placing them in a microwave safe bowl, using a small amount of tap water and heat at a high setting until, again, the vegetables are tender, probably about 3 to 5 minutes. We're going to drain the vegetables or fruit and save that cooking liquid. And then we're going to puree the vegetable or fruit down and gradually increase that cooking liquid until we get the desired consistency. We'll provide baby his or her portion and then freeze the remaining puree for later. Here's a recipe for our fruit and yogurt smoothie. So we can start with 1/2 cup of frozen fruit, 1/2 cup of plain yogurt, and then 1/2 cup of breast milk formula or whole fat milk. Again, placing them all in a blender and pureeing until smooth. And then we can pour out a little bit for them and then again freeze the rest. Alternative suggestion, so you could make frozen fruit or yogurt pops. So again, placing 1/4 cup of the fruit and yogurt puree into frozen treat molds and then freeze until firm, and you can serve them as a snack. If we are adding yogurt, we just want to make sure they don't have any artificial sweeteners or added sugars. So using a plain yogurt is best. So take home key messages from today. So starting solids can be a lot of fun. We want to make sure baby is ready, ensure they are positioned safely, focus on high iron foods. 9 to 12 months, we may introduce that 3.25% or homogenized milk. However, we want to ensure baby is consuming those iron-rich foods at least 2 times a day. We want to aim for 2 cups of milk, but no more than 3 cups per day. following their lead, trusting their appetite, avoiding honey until 1 year old, always monitoring baby when they are eating. You could even take an infant CPR class to be prepared if needed, if you felt more comfortable. We want to make sure that we're monitoring baby's growth using their growth curve. All right, so thank you so much for joining me today. I hope this was a helpful presentation for you. You can always check out our website. There's lots of other nutrition or other health resources on there if you're interested. Otherwise, I hope you take care and enjoy the rest of your day.